everybody, and welcome to podcast 184 of Beyond the Basics Health Academy. I am your host, Dr. Meaghan Kirschling, and I'm joined by a friend and a colleague today. I am joined by our acupuncturist at One Agora Health, Andrea. So hello, Andrea.
Hi, everybody.
Well, I'm so glad that you are on the show and you're going to talk about acupuncture and talk about the benefits of it and who can benefit from really getting both acupuncture, and I know you also do cupping and some other Chinese healing methods. But before we dive into the conversation, let's talk a little bit about you. So tell us a little bit about how you got interested in acupuncture and how you sort of got here today.
So I guess it started with my own health journey. I had extreme anxiety in my 20s. And I had tried multiple medications and nothing really ever seemed to work for me. And going to the doctor, it was always just like, oh, well, we'll put you on this medication. Oh, you're still not feeling good. We'll up your dose. You're still not feeling good. We'll up your dose. Well, maybe we'll try a new medication. And I never really got anything else from it. And so I guess that's what brought me to Chinese medicine. And it was so nice to, be able to go in. I would feel better after the treatments, after the acupuncture treatments. I started taking herbs on my own, and those really helped. And then just getting some advice, too, just about lifestyle and coping mechanisms and different things that you can do along with the acupuncture and herbs, and not just like, here, come in once a week and
let's find the right medicine and you'll be okay.
It was like really like working, with alternative medicine, I feel like we do a good job of working with the patient rather than just giving them one solution. And then if that doesn't work, one other solution. So yeah, I guess that's really what got me interested in acupuncture.
And I know one of your passions is working with people with depression and anxiety and using acupuncture because you can see a huge benefit from really being able to sort of balance the body and get the person sort of out of some of these pathways that are there because of the fact that their body's sort of trained to go into anxiety or depression or whatnot.
Yeah, and I find too that when people are coming in for something completely different, whether it be like digestive issues or pain, if you come in for an acupuncture treatment, you're going to get asked a ton of different questions.
And questions different than most.
About things that have nothing to do with the reason you're coming in. And I would say it's unbelievable how many people, when I ask them if they ever have anxiety, they're like, oh my gosh, I can't even handle it. Every day I've been having panic attacks. And then it's like, okay, well, this is a big piece of the puzzle and we need to get that under control. Otherwise, you're never going to feel 100% okay.
Mm-hmm. And I think it's interesting, too, because anxiety sometimes, too, is such a huge symptom, just like you're saying. Like, it's really the tip of the iceberg to something else going on. And I think a lot of times in traditional medicine, we sort of view it as a diagnosis. Like, we tell somebody, oh, well, I know what's going on. You're depressed. Or I know what's going on. You're anxious or you have anxiety. When really, it's like you're saying, it's such a big piece of the puzzle. And it's such a big component of what's going on. But it's not always necessarily the cause. A lot of times what it is a symptom because of something else going on or out of balance in the body.
Oh, for sure. And I feel like a lot of times it's not only a symptom, but it's kind of almost like the cause of other symptoms that are going on. It's all connected. And that's what I love about the medicine, because Chinese medicine is all about balance, and it's all about, how the different systems in our body work together, and how if one thing's off, then it can just throw everything else off.
Well, and like you said, too, with your intake, I mean, as soon as somebody goes and really sees a Chinese medicine doctor, they go and see, somebody for acupuncture, they realize that, wait, everything is connected. It's not disconnected. Even back pain is not, disconnected from these emotions that you're going through.
Exactly, yeah.
So I think that that's one of the things that I'm always so intrigued with acupuncture is that it really is an art and science that has been around for 3,000 years. So these patterns that you're finding, not only, do we find patterns in people, but they've really set these systems, patterns throughout the body, the day, everything that have been established over 3,000 years.
Yeah, it's really interesting. So, acupuncture, Chinese herbal medicine, cupping, all of that is kind of like under this umbrella of traditional Chinese medicine. And like you said, it's been around for, about 3,000 years. And it really views the body as a system. And when you're doing acupressure or acupuncture, it's based off of the body's meridians. And the meridians are actually connected to the different organs in your bodies. So it's the idea that if something is off with one of these organs, the flow of energy throughout your body is disrupted. And it can be disrupted by anything like physical trauma, emotional trauma.
Or all of the above.
Or everything. Yeah. Pretty much everything. Our environment, our lifestyle, whatever it may be. So when we're using acupressure or acupuncture, we're utilizing specific points on these meridians that help to kind of correct the flow of energy to get everything working in the way it's supposed to, so everything can be back in balance. And like you were saying with the patterns too, it's really interesting because this is way back when they, didn't have MRIs. They didn't know where the organs were in the body or like what the function of each organ was. And so they kind of made this like beautiful explanation of what each organ is responsible for. And there are these, when it comes to diagnosis, we find that certain people fall into patterns of, maybe one certain organ and not functioning in the way it's supposed to, that causes a specific set of symptoms. And it amazes me every day because the system is so old.
Yeah.
And then, you talk about someone who has a specific pattern and these are the symptoms that go along with it. And I see it every day. I could go back into my textbook and be like, oh, this person is a textbook spleen qi deficiency.
Yeah, and they really do like fit that pattern. And
yeah,
one of the coolest things that I've really been able to connect is my first healthcare job was on organ transplant. And I was an organ transplant nurse. And one of the things there is you get to see organ failure, unfortunately, manifest in individuals. But at that same time, I was going to chiropractic school and did some studying in acupuncture. And one of the things that I thought was always really interesting is that they're really more connected and they're really a lot of similarities than we really let on sometimes. And even though they've come about it, like you talked about MRIs and things like that, they've come about it different ways. And, really when we look at sort of conventional medicine through our system, that it's really sort of supposed to be evidence-based and it's a newer science, truthfully, is that one of the things that we see is that there's still a lot of similarities. And so on organ transplant, obviously we would see these individuals go through organ failure. And so you would see like when liver failure happens, those people are very angry. They're the ones that are honestly flinging poop at the nurses for no reason. They're yelling at their family members. And they're not angry people. Obviously, too, it's because that organ is failing.
Well, and like what Meaghan is saying is in traditional Chinese medicine, each organ correlates to a specific emotion. And the liver does happen to be anger, usually.
And kidney, and when we'd have people going through kidney failure, they'd be the paranoid person. We were on the 6th floor of the hospital, and they'd be like, there's someone outside my window. Like they're trying to break in. And so it's interesting because we'll explain it differently in traditional medicine. Like we'll say, oh, your ammonia levels are high because your liver's failing, and that's leading to your brain being angry and you showing anger. Or that the kidney is failing, so you're having higher levels of urea and whatnot, so then you're becoming paranoid. But it's so interesting to me because I got to see these patterns.
That is so cool.
And
to be able to be going through all of that at the same time and to like actually see it.
And so it really like stuck to me then, like, wow, this is really amazing that the patterns, obviously, that they've built over 3,000, we can really see, especially when we have such a vivid example of organ failure. But you do see the difference of liver leads to anger, kidneys lead to like paranoia and fear. And I see it all the time when people come in with stomach cramps.
Like worry, overthinking. Yeah, definitely.
And so the emotional part of really the 5 elements, which I think we might want to dive into, because that I think fascinates me every day, just how right on it really is.
Oh, it definitely is. And with the 5 elements, you've got water, metal, wood, earth. What am I missing? Fire. Is that 5?
Yep.
Okay.
Yep, you got
them. Yeah.
So we should go. So water, metal, earth, fire, wood.
Yes.
Okay.
Yeah. Okay. So
We listed 5 there sometime. I think we might have
right.
repeated one, but yeah. We'll put it in the show
5.
notes correctly. Yeah.
Yeah, that's probably a good idea. Maybe we'll just make a chart.
Yes. Yeah. Give everyone the Chinese chart of elements. So.
Yeah. So each element does represent a different season or time of the year, and it correlates to a specific organ, a specific emotion, and then so many other things like a specific taste, a specific color. So for example, spring is coming, and spring is liver season, as we talked about. So a lot of times when the season starts to change, their liver just starts to get unbalanced, and you see a lot of people getting like a little angry or getting headaches, migraines. You see a lot of digestive issues kind of flare up. And then allergies is another big one that you see in the spring, obviously, because it affects the lungs as well.
Mm-hmm. And then also the other thing I really think is interesting is the day clock.
Yes.
So not only do we look at different seasons, but every day we sort of rotate through this clock. So maybe talk a little bit about that, because I see it a lot with sleep disturbances too.
Mm-hmm. And a lot of times that is the liver. And that's another thing that you see pop up a lot once we start going into spring is people are waking up between like 1 a.m. and 3 a.m. in the morning. So yeah, it's the clock actually describes like the different times that energy is kind of passing through that meridian and that system.
And we talk about that for sleep too, because what they've now realized is that you sort of go through different times where your body's like detoxing and processing.
Mm-hmm.
And so it's interesting to me because we try to scientifically explain this at the same time that we try to start to say, oh, there's no place for Eastern medicine or
Mm-hmm.
Oriental medicine, but it's like we're finding the same patterns.
Yeah.
We're just doing it a different way.
Yep, exactly.
So I think another interesting thing is to really talk about your schooling and to talk about what it takes to really become a certified acupuncturist and become certified in Chinese medicine. Because I think a lot of people get confused. Is this just something you picked up on the weekend?
Nope, it is not. And it's funny because a lot of people do think that for some reason that. And it's funny to me, like that you would actually trust someone to stick needles in you that you think maybe only learned how to do it like over a weekend course or something. But that's another discussion.
But it's a 4-year program, correct?
It's technically like more like 3 years.
Okay.
So it's actually a master's degree that you have to get to practice traditional Chinese medicine and acupuncture. It's 3 years of, you've got your traditional Chinese medicine diagnosis, your point location, your practice needling. You've got all the Western medical classes too, your anatomy, physiology. I was lucky enough to be at a school where we had a cadaver lab even, and that was really cool. But we also it's like over 500 hours of clinical training where we're actually treating patients in clinic before we can get out there in the real world. So it's very comprehensive and it's very tough. And then when you're done getting your master's degree in Oriental medicine or acupuncture, you actually have to pass 3 or 4 national board exams in order to get your license. So in our country, that's kind of like the standard of practices. You have to be like nationally certified,
to be able to
board
do it.
certified, yeah. And then I'm licensed with the medical board as well in Minnesota.
Well, so I want to ask you a few questions. So Andrea and I don't get to sit down very often, but I like to really talk about a couple of things that I've seen really benefit from acupuncture and talk a little bit about it.
Yeah.
So I'd like to first start talking about hormone imbalance because obviously hormone-wise, I've seen a lot of women with PCOS, infertility, even problems with cycles, and I think it's a great, great, great option, especially for one of my passions is to try to not get women on birth control at 14 years of age.
Yeah.
Unfortunately, we're starting to see a lot of people now who are on birth control for 25, 30 years because they're on it for cycle regulation. So let's talk a little bit about hormones and what acupuncture can do in all age ranges to really help with hormone balance.
So acupuncture just has this really awesome way of regulating all these different things in the body. It can help to regulate the hormones. It helps to, regulate different neurotransmitters. With hormones specifically, I find that it's really great for regulating the cycle. So I've had a lot of patients come in who have just stopped getting their period and they haven't had it for a year. And with regular treatments, we do get them on the path. And usually for patients like that, it's just a matter of like weekly acupuncture sessions, maybe some herbal medicine to get them back onto a regular cycle. It's also really great for PMS. And any sort of like cramping, any symptoms that you get around your period. A lot of times women who are going through menopause with hot flashes, it helps to regulate that. And it's not a magic bullet. It's something you have to keep up with, but it's natural. You're not pumping your body full of all of these synthetic hormones, which is huge because that ends up causing problems later in life. Whereas acupuncture really doesn't have those side effects. It just helps to regulate.
It's also the complete opposite of birth control, which I think we don't talk about enough, is that you're reconnecting the body. Like you're balancing out the body. Where what birth control is it's disconnecting your brain and your reproductive system.
But don't try to get acupuncture to prevent pregnancy.
Yes, I think that's a good,
just for regulating the cycle.
Yes, no, I just am really adamant and just really think it's a great first line for especially young women who aren't given a lot of other options, who know that something's not right with their cycle, who aren't regulating their cycle correctly, and that especially like at 14, 15 years of age, be able to come in and really get a full assessment, see what things are out of balance, and then use that to help to connect and regulate the cycle versus when you don't need it for birth control to go on it for long periods of time. And then you have a woman that's on it sometimes now 20, 25 years before they want to get pregnant, sometimes in their late 30s.
Oh, yeah. And I mean, I've seen really amazing results, especially with younger women, people who are 14, 15. But unfortunately, most of the people that I see are the people coming in who say, I've been on birth control for decades.
Yeah.
And now that I'm off of it, everything is just out of whack. And it's more about getting them back onto a regular cycle.
So I'd also like to talk a little bit too about pain and acupuncture, because it's also a great non-pharmaceutical way to control pain. And I think now we're looking for, especially with the opioid crisis, ways of getting ahead of pain. So talk a little bit about what acupuncture can do for pain control.
So acupuncture, now that we are able to do more research on acupuncture, we found that there are so many different mechanisms of action with it. And it actually does help to produce endorphins, which are the body's natural opioid. You've maybe heard of endorphins because you get them after you work out. But they just make you feel good. It also helps to increase circulation, which is really important if you have any sort of injury. And it helps to reduce inflammation as well.
And then the other thing that I've seen acupuncture work really well for, better than some of the other options out there, is sleep. So maybe let's talk a little bit about sleep too, because I think that's something a lot of people struggle with and don't have necessarily great options out there on what to do for sleep.
Yeah, acupuncture is really great for sleep. And the thing about sleep too, like we were talking about before with the whole, waking up at different times, by asking questions like that, you can really figure out what's out of whack and what's out of balance and find a treatment that's really tailored to the person. Because a lot of times I think with Western medicine, somebody's not sleeping well. You tell them, oh, just take this medication or try this supplement that sometimes helps people fall asleep. And they're not really looking at like, oh, is this person having trouble falling asleep, or are they just waking up multiple times during the night? Is there a certain time that they're waking up? Acupuncture really kind of looks deep into the different, the different imbalances that are going on. And it really does help to just target those specific systems that might be out of whack. And, there has been research that's been done that shows that it kind of changes the different neurotransmitters that are being released with regular acupuncture treatment, neurotransmitters that affect your mood and your sleep.
Mm-hmm. So to sort of wrap up, is there one thing or sort of like what would you sort of talk to people about, any like misinformation or anything out there about acupuncture?
Well, it's not voodoo.
Okay.
It's not. Like we were talking about before, it's a system that's been around for over 3,000 years. When you really dive into the old terminology and things like that, it might sound a little off, but like you were saying about your time, with the organ transplant patients, there really is a lot that ties in and a lot of similarities that, we've maybe missed with Western medicine. And it's just about regulating the body and creating balance and allowing it to heal itself, which it's made to do.
Mm-hmm.
And what's the other one? Oh, do the needles hurt? I get that question all the time. People always ask me that. And an acupuncture needle, it's much thinner than a needle that you would have for like a blood draw or an injection of any sort. They're filiform, so they're not hollow. You might feel a little prick when it goes in, but for the most part, people don't really feel them at all.
And it's cool when you have it done and you can actually feel like the energy moving, the chi.
Mm-hmm.
And you can feel like it's not painful, but you can feel just like that movement of energy, especially when you hit a spot that's really stagnant.
Yep, exactly. It's really cool too because the acupuncture points on the body are kind of like, they're like little pit stops along the meridians where the energy pools. And then, when you look at imaging of where the acupuncture points are, they are areas that have like a higher concentration of nerve endings and vascular structures. So the body reacts really quickly to something stimulating that area.
Mm-hmm. Well, thank you so much for coming on. I just think you're a wealth of information, and
Thank you.
It's just really, I think, great to sort of break down acupuncture because there's a lot of misinformation out there, a lot of people that want to try it but don't really know what would I try it for, why would I come in, and really anybody would benefit from acupuncture.
Oh, definitely.
And if you have any questions for her, you can always email her at info@oneagorahealth.com. So thanks, everybody, for listening.
Thank you, Meaghan.
Yeah, and thanks for coming on and sharing all your information with our listeners. So thanks, guys, and have a great day.
Bye-bye.